For the most part, the pain that people experience after a sling procedure is more of a pelvic pressure or achiness, and oftentimes can be overcome just using nonsteroidal anti-inflammatory medications like ibuprofen or naproxen. There are some patients who may require narcotic analgesics, but that's few and far between. We normally recommend that people take it easy for the first 24 hours after they get home. In other words, avoid any kind of strenuous activity. Nothing more than getting your meals, getting up to the bathroom, and maybe reading or watching television. Usually by the next day, you're able to resume relatively normal day-to-day activities, although we do recommend avoiding heavy lifting, pushing, pulling, or strenuous exercise for at least a week after the procedure. The incision site generally is going to be in a location that's not really visible to most people, but they can notice that they'll have a little bit of bleeding from the area because, again, it is an incision that's healing. For the most part, that bleeding tends to be quite minimal, and most people get by with just a panty shield or something, a liner for their underwear. If there is excessive pain in that area, or if people notice any type of discharge that looks more like pus than just a bloody discharge, that's something that they need to contact us about right away because the potential for infection is always there, although relatively rare. For the most part, we recommend that patients shower rather than bathe for about a week or so. The area of the incision from the sling procedure is actually tissues that heal relatively quickly. So typically, as long as you're in a clean water situation, such as a bathtub or even a pool that's chlorinated, for the most part, people can get in water after about a week or so. Prior to then, again, we would recommend just a shower. As far as any type of lifting, we normally say best to avoid anything more than about 10 or 15 pounds for that first week. Maybe keep it to about 20 pounds or less for another couple of weeks after that, but then people should resume pretty much all their normal activity after a few weeks. Driving is something that we generally recommend holding off for at least 24 hours because of the effects of anesthesia. That being said, the next day, most people are able to drive just because they're not having to take narcotic medications. If you are one of the patients who may require narcotics in order to keep their pain under control, we recommend that you don't drive while you're taking any kind of narcotic pain medication. I have a lot of my patients who return to work after the first day. If people have the luxury of being able to take a day or two off of work, I think that's perfectly fine, but most people say they function absolutely normally within a couple of days of their surgery. Technically, it takes 6 weeks for any type of incision to heal fully. In other words, where it gains about 90% of its normal strength. Because of this small incision, we find that that's not problematic from the standpoint of being able to resume a lot of normal activities. Because people can go back to work unless they have a very physical job that requires a lot of heavy lifting, within a day or two, I would say most people would consider that their recovery time. That being said, one of the other restrictions we normally give people is refrain from intercourse for about 2 weeks or so because that area is going to be quite sensitive, and there's always the potential that it may increase the risk of infection while that initial healing is underway. Like with most surgery, we recommend that patients contact us if they have nausea or vomiting, if they have difficulty voiding, if they find that there's a lot of bleeding coming from the incision site, which would again be seen as vaginal bleeding. Any type of a fever, a temperature over 100.4 degrees, any chills or nausea or vomiting, anything like that, definitely would require a call to the office. For the most part, if people call with those types of concerns or complaints, we'd like to get them in to be seen here in the office rather than trying to send them to the emergency room or urgent care centers, just because we're much more familiar with that surgery itself and what sort of complications may arise from it. In general, patients are seen for a post-operative visit, and I like to see them usually within 2 or 3 weeks, just because I know the recovery tends to be fairly quick. For the most part, after that, it's an as-needed basis, although oftentimes we will have people come and see us after about 6 months, just so we can touch bases to see how effective the surgery has been for them on a more long-term basis. If you have questions following the procedure, the best thing to do would be to call the office. That during regular business hours would connect you with one of our phone nurses here in the office, who can then talk it over with either your own surgeon or with what we call the proctor physician here in the office. And there's somebody here pretty much every day during the regular daytime hours. After hours or on weekends or on holidays, you generally are going to contact our answering service, who will then get through to the physician who's on call for our practice, who will then review the complaints and decide what sort of follow-up would be necessary, whether it's an office visit, whether to come into the emergency room so you could be seen, but it will be addressed.